a challenge. Over the last, first of all, a week ago, it was reporting very high figures. Now they are reporting slightly lower figures, but Nakuru, nonetheless, is a challenge. And the way forward on these issues is that you will remember when we began these things, we had closed some towns. We closed Mombasa, if you remember. We closed Kilifi at the start of the epidemic, and we are watching the situation, so that in the event that we believe that it is unsustainable, and by unsustainable, define unsustainable to mean what is the level of hospitalization, what is the level of ward bed capacity, are they being overwhelmed or not? That is essentially how we will define whether to close completely or lock down an area or not. As far as sustainability is concerned, you know, it is actually sustainability will automatically going forward for all of us in this small globe we call the world. It is a behavioral change issue. Everybody will somehow just have to change. And I think more today, you can't talk to a single individual who doesn't know of either a person who has been, who has got the virus, or a person who knows somebody who has got the virus, or has not been infected themselves. The last time we were here, I think, is Dr. Ali was telling us that he had been infected himself. So now we know that it's with us. And I think that the only way to sustain this situation, the only way to sustain an economy and sustain people's lives and keep going, irrespective and in spite of, and you're right, the predictions even from CDC, even in the US, is that this is not something that is going to go away tomorrow. So somehow we have to learn how to live with it. And the only measures that we can take are the containment measures, but more so the behavioral changes that are necessary to do so. On the issue of the vaccines, there was a question regarding vaccines. As you know, there are several of them now that have been announced all over the world. Yesterday, I was watching on TV, and there are some now that are being withdrawn because of the, what do you call them, Daktari? The side effects. The side effects of the drugs. You remember even Zeneca had produced a drug that had been withdrawn for a while. No, a vaccine that has been withdrawn for a while. There's a Chinese one that was being withdrawn yesterday. They were saying they won't withdraw that one for a while. There's an announcement that Abbott as Biosensor have got some vaccines. There is even the latest one that we are being told about from Pfizer. So we are watching the situation and wondering. We have also got ours that we are testing. You know, here in Kenya, welcome Kemri, are also testing one here in the country. So if you ask me, I would probably say the jury is still out. We don't have a very specific thing that we know about. We think that the rest of the world, that in the next 6 months or so, we might be a bit more confident with the results. There are organizations globally, including the World Health Organization, the Bill Gates Foundation, who are saying at the first instance when these vaccines are available, they must be made across board, not just for the rich countries, but for all people across the world. Obviously, that is easier said than done. You have heard that UK has pre-ordered some 30 million vaccines, some 30 million vaccines from Pfizer as we speak for trial, you know, so that they can also try them in the UK. And for poor countries, it's a challenge. It will be a challenge, but hopefully it is a challenge that we'll overcome with our own budgets and also budgetary support from where we must get it. So the jury is out. I am not sure. What I'm told, and perhaps you, Dr. Chek, are in a better position to deal with this, is my issue as a layman who is not an infectious disease expert. My issue is, I am told that this vaccine is supposed to stop you. It's supposed to stop you from getting the virus. They have tested, I don't know how many people, and they have stopped them from getting the virus. I know of somebody who shares a bedroom with somebody who is positive, and the person doesn't have the virus. So my question is this: how do they know I was going to get the virus? But that's a story of another. That's a story of another day, and perhaps I'll be educated and not ask silly questions later on the matter. But on the issue of the isolation centers, there was a matter that mentioned. I think his captain talked about isolation centers at some point, and the point is this. I think I told you earlier how we have learned some things over the last couple of months. We learned things. And yes, the schools were where we were isolating people. And at some point, if the situation were to completely worsen, it might be necessary to even then to restart some form of isolation centers. But currently, the method that we are using is essentially home-based care. And so far for us, it is working. And it is forcing people to be absolutely careful, is bringing discipline even within the families. Because when you have got a daughter or a father or a mother who is positive, and you're managing them at home, your best friend in those circumstances is distance and a mask. Distance and a mask, distance and a mask. And you know that. And you know the person is there with you, and you know that they are positive. And the only way to save the family is to do exactly what I'm saying. And it is working. And I want to thank Kenyans for this. It is working. The largest recovery rate in the country is actually from home-based care, not hospitals. On the matter regarding our brothers and sisters across Tanzania, you know, Mheshimiwa, the only question I would ask you, and perhaps again this can be responded by our colleagues who are infectious disease experts, is how in your own county, in your own constituency, that neighbors that has got a geographical boundary, not a stone wall, not the Mexico-US wall that we have heard about. It is just an imaginary boundary that is across. This is Kenya, that is Tanzania. And somehow, in your constituency, you know for a fact that you have got cases. You know that for a fact. You are crying for isolation centers. You are crying for ICU beds to be made by your governor, and so on and so forth. So it is not something you are thinking about. It is something you can see with your own eyes. Under some form of magic, once you cross that imaginary boundary, you know, abracadabra. It's okay. There is nothing. I mean, honestly, are we supposed to believe that? You know, I mean, it doesn't take instant mathematics to know that clearly some people are managing it differently from us. And we have no way of knowing. I can't give you figures. I don't know what is going on. And because we are dealing with a friendly state, you know, I can only imagine that they have got a different philosophy on the disease from ourselves. For us, the issue is that we are a democratic society. We are an open and transparent society. And we must tell everybody everything that is going on, whether good or bad. And we share the burden together as citizens, not as leadership hiding things. We must share this burden together, citizens, government, and elsewhere. Finally, dadangu kutoka Lamu, Mheshimiwa, vile ningesema ni hivi. Ya kwanza, hakuna kaunti hata moja ambayo haikupata pesa. Kaunti zote zilipata pesa za kupigana na hii virusi. Hiyo ni ya kwanza. Ya pili, pesa mashinani kama unavyosema, pengine itaonekana na itapatikana rahisi tukienda huko na tukiangalia ni mikakati gani imewekwa, ile kama vile masharti tumeweka inafuata, ni kanuni gani ziko huko, na tutakuja Lamu. Mimi mwenyewe tutakuja Lamu kwa sababu ni lazima tuende kila county kuzungumza na magavana, watueleze ni vipi wamefanya, na vile vile watueleze tunaweza kuwasaidia na njia gani. Kwa sababu hatuwezi kujua tu. There is a reason why there is devolved government. Sisi hatuwezi kuingilia kazi ya magavana bila gavana mwenyewe kusema sisi tuko na shida hii, tuko na shida ile, tunataka usaidizi gani. Na ile mimi naweza kukueleza ni kwamba mimi sijawahi kusikia kilio kutoka kwenu kusema ni wewe unalia wewe mwenyewe, na kweli na kuhurumia. Lakini siasia hiyo kilio kikubwa kwa gavana akisema tunataka oxygen haraka haraka, tunataka ventilator haraka haraka ndio tusaidie hiyo mambo katika kama serikali kuu. Kwa hivyo tutatembea huko tushughulike na hiyo maneno, lakini pia ni vizuri viongozi kwa ujumla, nyinyi watu wa Lamu kwa ujumla, viongozi wa Lamu wote kwa ujumla, pia mshikane na muwe kitu kimoja, ndio hiyo msemo utoke kwa nyinyi nyote badala ya mtu mmoja. Nasikia sijui kama unanielewa mheshimiwa. Nimekuwa najaribu Kiswahili lakini siwezi kama yako. Mheshimiwa Koros, the issue of the cost of testing, it is true that as a government we set it up at about 2,000 shillings. Those who want to be tested, because those we follow on contact tracing ourselves, we don't charge. On grounds that we consider that as emergency measures. We are aware, of course, that across the country there are labs that are charging a huge amount of money, and we have told them this is unsustainable and not welcome. I can tell you this: in terms of the costing of the reagents, the fast testing kits, that the issue that has been raised by the chair on the matter of the fast testing kits. Two things about them. Number one is, yes, we are going to start using the fast testing kits. But number two is that they are expensive to use. They are not as cheap as the manual PCR testing. Because my estimation is it costs about $20 or so. The cost is about $20. Between $16 and $20 is the cost of the reagents for testing on PCR. The cost of, at the moment, it will come down eventually. But the moment is about $60 for a rapid testing kit, because they're expensive. And also, there are a gazillion of them. So we are having to rely on the ones that are recommended by the World Health Organization, and not everybody else who has come up and tell us that they have got a rapid testing kit. Because what happened originally, and I think I alluded to this the last time I was here, what happened is that countries in Western Europe and America resorted to using rapid testing kits that all eventually proved useless. And some of them they had to return. So for us, we want to, because we are not rich, with the little money we have, we want to ensure that every kit that we are using is useful so that we can be able to bring that cost down. And we hope that as more production increases, we will indeed bring it down. But it is not cheap to test. And for the government, it is very expensive to keep on testing. Now, never mind that one person who is positive cannot survive on only one test, because you test them to prove positivity, and eventually you have to test them to prove negativity. And sometimes you test twice before they are proven negative. So that is 2,000, 4,000, 6,000 per individual. It is very expensive for us as a government. The testing centers we have increased substantially. I was in Kericho myself at the Cambridge testing site. They have got fantastic capacity, except that the machines they are using are American machines, Cobas machines, and it has been impossible for us to get the reagents that they would use for those machines, essentially Roche testing kits, because the Americans blocked us. So if we could get the reagents, we have a sufficient testing capacity across the country. The problem is the kind of reagents that we are getting. We have also going to increase the number of machines that we have got under our World Bank program. We are increasing the testing machines that we have to spread into counties that may not have them. So it is work in progress to expand it. We have come from 0 to over 40. So we are making progress, but still more needs to be done.
Thank you. I don't know whether Belly had something to add, or we now go to the next level. Allow us to go to Honorable Duale, Honorable Kutuni, and then you will now do something was not answered.
My question was not answered. The first question.
Which?
If I ask again in English. CSI asked, is it true that NHIF is not going to pay for COVID-19 patients? considering Lamu, we've been investing more on NHF, are not going to pay for COVID-19.
Is the payment of NHF to COVID, cover to COVID?
Well, yes and no. Yes and no, in the sense that if somebody has got, the fact that a person is positive, and they are here, they respond for themselves. I wish the CEO was here. The person that a person has got is COVID positive does not mean that they are excluded from treatment. But they do have exclusion clauses, which they will themselves explain in a minute.
Okay. PS Belio, did you have something to add before I give the next round of the...
Yeah, there was something that Dr. asked on provision of masks. I think, as said by the Cabinet Secretary, is that the direction to go is that this becomes part of the essentials that a child has to get as they go to school. But what we shall do as government is that there will always be interventions. Just like we have interventions today on scholarships and bursaries, targeted school feeding program, I think as we move forward, and that's where we are going to work with ourselves and honorable members through the National Constituency Development Fund to see how do we continue some of the interventions that will be necessary to intervene. But the total coverage of all students, I don't think that will be possible, Chair. Thank you.
All right, members, if I look at time, we're already past 1:30. It's actually 20 minutes to 2. We had another session in the afternoon. So like we go brief to the point, Honorable Dwale, Kutuni, then... okay. Just, I think we can limit ourselves.
You've given. And I'll just start by saying that, Waziri, in your request that you visit also those counties in the north. For example, one county that you can easily visit is number 2, the issue of ICU and oxygen availability. If there is a way that we could have a toll number to call so that we can know where these facilities, as you said, these facilities are available, but then it's not known. So the best place to coordinate such kind of thing would be the ministry, so that we can call this free toll number where you can say we have a patient who needs ICU, HDU, or whatever, where can we take, and then you say you are located where, and that will be one way that you can actually enhance. For the Ministry of Education, I know that we have open schools for class 4, class 8, and Form 4 secondary schools. And I think that the plan is to open schools maybe next year if things don't go worse. Now, from the opening of the schools, do you have, whether a Minister of Health or Education, do you have an indication of the disease trend in the schools right now so that we can actually use it as a predictor to know that once we have opened now and we are going to open schools in a big way, how it will be? Finally, on the issue of, I think the issue of enforcement. Police are doing their work to try to enforce COVID regulations. But sometimes we see that the police might arrest people and keep them in vehicles crowded in the cells, which also puts the people at risk and also themselves at risk. What is the ministry doing to try to educate the police officers so that they don't put themselves at risk and also the public who they are arresting? Thank you.
Thank you, Madam Chair. Waziri, we've been dealing with this matter for some time now. Yet before the committee to give us a roadmap the government had put in place. You did indicate that there was a task force or a team of experts that was advising the government. And we agree, all of us, that earlier before, or maybe at the onset of the disease, the government, through the advice of the technical team, came in, put in place measures that actually we saw the management of the disease, the containment of the disease, it was at its best. And all of us, even including the committee, we were happy that the government were putting efforts. I remember when you appeared before the committee, I did praise you that you've been doing quite a very good job. But after the restrictions were lifted, we've seen again a surge of the disease. And the government and the president will not act alone. They act under the advice of this team. So should I say that perhaps maybe the government or the president has been misled, or perhaps maybe the team did not do proper due diligence for the government to lift the earlier restriction that we saw that it was containing the disease? And if that is the case, so, because right now it is concern of everybody. In the villages, every week we are burying not less than 10 people. And these are elderly people, 55, 65. If you go today to some hospitals, you'll find the grandfather, the grandmother, and perhaps maybe even the children are in the hospital. A case that I don't want to explain, to say here, in public, in most of the North Rift region, the hospitals are now becoming full. And you realize that perhaps maybe it's the entire village. Do you consider imposing the earlier measures that the government had put in place that was containing the disease? That is the ministry. And then the same committee, we expected the same committee to advise the Ministry of Education, because I'm sure the Ministry of Education has no capacity at all in containment of the disease. The PS, good enough. You've put in place the measures that you have, that is in place, including the issues of the face mask. But the face mask that you're putting in place, or perhaps maybe that you've collected from well-wishers, is only 1.8 million, it's 2 million. And the children in school are almost 10 million. These parents have no source of income. They can't even right now buy food. How will they even sustain this issue of changing the face mask, or first providing face masks for their children? Don't you think that you put the cart before the horse? Many schools are not prepared, including the parents. They were not prepared in opening school. What was the criteria that you used to arrive at the decision of opening schools? Again, don't you feel that you are so unfair to the parents now that you gave parents only 2 weeks? At least for the Ministry of Health, they were giving parents, they will give people time to prepare. But the ministry gave parents only 2 weeks. Parents were not prepared. They have no school fees. The schools are not prepared. You've talked about the protocol that have been employed in school. I want to tell you, one PS, that if you go to most of these schools, there are no face masks, there are no water points for these kids to wash their hands. If it is only one, serving 300 or 400 students. Some, they don't have toilets. Now, don't you think that you're putting the life of our children into risk? Now, you've also raised the issue of the parents misbehaving, social indiscipline that is there, that the disease now is being spread by adults to the children, and then the children now bring it back to school. Don't you think that also the Ministry of Education did not prepare enough? They did not consider all these factors that are going to contribute. And then finally, don't you think that it is also time for you to review if you really think that we need these students in school, or we wait until the time the president, the way he had mentioned that we open in January, because you've got standard 4 children. They come to school and they go back home. They transmit the disease. They take to their sisters and their brothers who are in standard 1. Are we really making any headways? No. And then lastly, I want to register my dissatisfaction on how the minister or the cabinet secretary for education has been carrying himself. Why are we praising the minister for health? He's been updating people. You see a gentleman in him. You see a leader in him. But what we are seeing in the cabinet secretary education, we are seeing a bully. We are seeing a dictator. We don't see any leadership. And he has to apologize to those government officials that he abused. All of us. I think we have a responsibility of bringing our heads together to sort out this disease. But it is not an issue of showing how bully we are. I think it is high time also, perhaps maybe whoever appointed him, review We are not afraid to say that. Why are we having a cabinet minister for health here who has really built trust to Kenyans on fighting diseases? For those few remarks, Madam Chair. Yes.
Who is on point of order? Sorry? Who said point of order?
So, Madam Chair, thank you. I think I need
Anyway,
clarification on those ones. Thank you, Madam Chair.
Appreciating the work that the two ministries have done in very difficult circumstances with the disease whose parameters we learn as we go along. I think something has happened. Mine will be, to a large extent, comments. There are many, but some of them, particularly in health, I can take with the officers because I know it works. But let's start with what happened when he reopened. I was following your data all along, and we went by the right data until you said, let's relax. Now, what actually happened after you relaxed? The guidelines you put after the relaxation were not followed. Simple. We didn't open. You said churches 200, funerals 200, vehicles you get numbers, curfew midnight to about 4 or 5 a.m. And hotels and bars, you put very clear conditions on what were to be done as we opened. The truth is, Waziri, they were not followed. And my question is, why was that not done? I can count two in this town, the hotels that actually followed. So then what happened? We went right back. So that is where, in my view, I saw the thing. We didn't open completely. We said, now you can go out, but you come back at this time. You can go to the bar, but you drink this time. But we just went and did everything. Why did that happen? Number two, regarding the issue of Tanzania, this is a question again. How, before I go to that, with the new guidelines you have put back, there's a gap. I don't know whether I'm the one who has not seen it. It came out very clearly, and I appreciate and I accept the blame that was put on the political class. It is true. I don't think we can deny it. But again, nothing came out of what is really happening, even if we don't say it. At the beginning, there was a lot of issue about travel across with vehicles moving and particularly transporters. And the issue was very simple. Our tests were different from their tests. I do not know how you harmonize that, because that will tell us what is happening the other side. Because as they come in and they get tested, if we lowered the cutoff, then obviously if you lower the cutoff, everybody's well. So I think there we also would need guidance that you have harmonized somehow. We don't hear the noise, but what actually is happening? It can't be that when you cross the border, nothing happens. So I think we would like some guidance on what is happening at the border when you are doing the testing. Now, a few comments, because of the time, is communication. There's been a lot of improvement in communication, because when you started, you were not even giving us the percentages. Then you started giving the percentage, which was very good. Now you are giving the percentages, but there's another communication that may be needed. One, when you say Kisumu has got so much, Nairobi has got so much, it will also be important to say how many were tested in Kisumu. Because just that is so much does not give you anything to talk about. So then we know they are bad and their level of testing. That's useful. Beds, it may also, because the perception around the country is that there are no beds, we are already overwhelmed. That's what people are saying. I don't think it would be wrong, but this is a suggestion, that actually when you give figures, you say the beds that are available, and even say where they are available. So that I'm in Kiambu and I want to come to Nairobi, I know I could get a bed in Mata or this place. Or I'm in Nairobi and I know I could get a bed in in Kiambu. Because if it is ICU, then you are better off even in a small hospital in Kiambu that has got an ICU than sitting in a large hospital and you don't have oxygen or ICU. I think that information will be another comment. If the vaccines come, there are two worries, in my view: the cost and availability. But with the vaccine candidates all over the world have a bigger worry: the temperature. They are all saying it is minus 70 degrees centigrade. The logistics of distributing that vaccine from the airport to Busia and making sure that it is still at minus 70 degrees centigrade will be a totally new logistic. The vaccines we have are -4. So you just use a home refrigerator. Yeah, 2 to 8 degrees. That can be achieved by a simple vaccine you go and buy. -70 is an industrial system. So what infrastructure? I would like your technical people to start thinking that if that is what happens, what are we going to do? Because even if you get the vaccines, that will really take us. Minister of Education, I appreciate one thing.
Honorable Nyikali.
Yeah, I'm finishing. You know, it is important to do this. This is Kenyans' lives, not going for lunch or having another meeting. Let's do this. If we do one good meeting, it's better than 2 meetings that didn't finish the work. So I appreciate the fact that you realize that the danger of opening schools was not the health of the children. The children they'll be affected, but they're likely to survive without dying. Your teachers, you are likely to lose a lot of teachers over 70 or with complications. 2, the schools being the focus on spread. I'm just appreciating that realization. And therefore, the other thing that I think needs to be looked at there, when we open, like now, have teachers become frontline workers, needing some element of protection? I think that's something we need to look at. And lastly, I don't understand why you are always predicting we will open on this day, we will open on this day. This disease is totally unpredictable. You will say January it has behaved differently. I don't know, I would have taken the approach of, we will let you know we are still protecting the children as we are, they are safe. When the time comes, we will let you know. And then if that time comes, you give a good period for people to plan. Instead of saying January, everybody is saying January is coming. January comes, no. So what is really the issue, even with the minister, is the unpredictability. Yeah, and I don't think I need to do that. I know you have the problem of planning the structure as go on, because some kids may even go to school 2 years older. So what? So what? But that is something that is within your system. We need not to know. We only know we are still not able to open for these reasons. When you are ready to open, you tell us and you give us a grace period. Sorry, Chair, for taking too much time, but I think I've not wasted it.
No, it's not wasted. It's very valuable. We actually just have 2, so just give it so that we wind up. One comment, so that we wind up. Dr. Murgo, then Honorable Beatrice Adagala.
Thank you, Chair. I'll be very brief. And this will be actually a question and already been opened. And I would like you just, Buenos Aires, just give us a brief, just 1, 2, 3, the protocols for air travel. Because in my experience, and I think last weekend I traveled from Mombasa on a local air flight, and one of the most essential protocols, I did not see it in place, particularly the question of social distancing. And incidentally, in that flight, Buenos Aires, I think I could count how many people were coughing around. So really, what are we doing? On the question of vaccines, Buenos Aires, definitely the vaccines are coming. The vaccines are going to be there. vaccines with minimal side effects. And incidentally, there is no vaccine actually without a side effect. So it will come. I would just urge you, please start planning. Let us not wait until when the time the vaccines are coming, you say, we don't have money. Start now. Start planning for now. And also adding to that account the question of the temperatures, which Honorable Nikala stated. The other thing is, we were doing very well when there was that lockdown. Of course, when we, released, that serious lockdown, of course, definitely there was improvement in the economy. But with improvement in the economy, there was improvement also in death. So the question is, you are releasing, okay, we are, opening it up and people are dying. Really, was that wise? And finally, for the Ministry of Education, I seem not to be with you in this question of opening of schools. If I recall very well, and I think I was seeing films of Second World War in Europe. That war was 6 years. In the whole of Europe and part of USA, nobody went to school. But did people survive? They continued. So this hurry of opening schools, infecting teachers, infecting parents, through opening of schools, was it wise really? Go and think about it. Thank you, Chair.
Thank you. Finally, Honorable Dagala.
Yeah, thank you, Chair. Bwana CS, yeah, this is a good time that you have come together on matters concerning the health of this nation. Mr. CS, I've been listening keenly, and I've seen from your presentation, you have said where we can get a few beds for ICU and for COVID-19 patients. It's like Nairobi, Kiambu, Murang'a, and Nyeri. These are just a few counties. A county like my county in Vihiga, and I would even complain the way my colleague has complained about her county in Lam. As we talk now, most of the frontline workers in Vihiga, they don't have the PPEs. And it seems now as we talk, with the opening of schools, partly opening of the economy, this disease seems to have now risen in those areas, unlike before. The graph now seems to be very high. You find in one village even over 10 dead bodies. And when you hear of the symptoms, you tend to fear. To remove the fear of these people, the people living in like the county I'm coming from, what measures is the ministry going to take? I know health is a devolved function, but as much as it's devolved, the people dying, the people who are sick are Kenyan people. What measures is the ministry going to take? Like, we visited an institution here as a committee. We even saw some equipments that were not being used. As a ministry, why can't you look at counties like a county like Vihiga that has maybe 5 or so, and the population is so high? As a ministry, why can't you get maybe such, you donate to those, our counties, to assist our people? We went to Kemsa, we saw a lot of PPEs lying there. And most county hospitals, they don't have them as a ministry. please don't tell us that health is devolved. These are Kenyans. These are Kenyans dying. An urgent intervention is actually needed. When it comes to the Minister of Education, actually, I want to echo the same sentiments. Our children are not safe in schools. Our teachers are not safe in schools. And from the time the schools were opened, that's the time these COVID-19 issues are now rising like hell. Because in the villages, that's where we have our old folks. And the grandchildren go to school. They come back maybe with the symptoms. You never know. And the spread is now very high, very high. Also, what I wanted to echo, although my colleague talked about it, and that one as colleagues, as members of parliament, we want to condemn it to the highest level what the minister did. Minister for Education did in an institution embarrassing a senior member. Even he may not be in a high post in government. But that's, when you look at the pictures, he's an elderly person. You cannot do that in front of the people. Us, as members of parliament, we don't condone that. PS, tell your minister to apologize to the teaching fraternity.
Point of order, Chair.
What is out of order, Captain Rueda?
I don't think it's okay for Mheshimiwa to tell the minister to apologize. We Kenya, we have to take responsibility. Ukweli lazima tuseme. Nataka watolee story moja hapa niliona.
Tena story.
Ngoja nielezee. Kenyans, we have to take responsibility. Mimi I support the minister kwa hiyo. Mengine simsupport, lakini kwa hiyo hauwezi kwenda kwa class ikiwa ni chafu. Unasoma vipi, unafundisha wale watoto vipi? Kuna siku niliomba lift kwa dereva ikawa ni mzungu. Mmoja wetu akarusha karatasi ya peremende. Sikuona, naona ile mzungu ana eka emergency brake. Anasema, mimi hata tukuangalia tunashtuka shida ni nini? Ali reverse akasema, you people who don't love your country. Alirudi nyuma akaokota hiyo karatasi. Kenyans, we have to work to take responsibility. Usilaumu minister wa Kenya. Mimi naona hata hizi ministries zipewe majeshi zote zifanye kazi. Wengine hawaendi mpaka wafanywe hivyo. Msimlaumu minister sana, acha afanye kazi.
Well, I think it's good for the minister to work, but also there's courtesy and
yes, etiquette.
I think there's we are all civil, and there's a way you can address somebody in a very respectable manner, and the same message goes in. Really, you don't have to be little and treat a person like they are small children.
Yeah.
So
we are told to wear a mask, and they don't wear a mask until the.
But you can't beat them.
Push them.
I think, yeah, we are in this thing for sure, but there is a way to address a lot. And especially, I think if I saw that photo, I saw that later, the man was actually an elderly man. You can still correct somebody when they are wrong, but with a lot of decency, being civil, and with respect. It's really, when you are a minister, doesn't mean that you are like above everything else. It's good, and I think we have seen our minister here being asked sometimes some very hard questions and answering them in a very nice way. We have seen it happening. I liked when he was asked about his son going out.
Yeah.
So he should, if it was that one, he would have answered in a very different way. So I think it's, yes, we are in discipline, but please let's treat everybody in a civil way.
Yes.
In a very respectable way. I want to take it back. Maybe I'll start with you, Belio, because your questions are not many, and allow the CS to wind up.
Some are above my pay grade, so I'll not mention that. Thank you very much. I think most of them were really comments, but as for trends in schools and the infections, I want to say that, and Wasiri will say that because it's a medical issue, is that schools are within communities. And if the infections are increasing in communities, then we would, by implication, expect some of these cases to also go up in such communities. Say that in some of the counties Wasiri has mentioned, in Nakuru, in Uasin Gishu, in Kisumu, suddenly schools within those areas, because most of our schools are day schools, if trends are going up, then if trends are going up within communities, then we would be able to see and expect this to happen also within schools. Honorable Kutunyo, on the issues of masks and why we did open schools, and I said this, and Wasiri has also mentioned it, is that at some level, we were managing and we were seeing that the curve was flattening at some point. And we were within or less than 5%. Would be necessary to go back to school. One thing I would want to say is that in most cases, we as Kenyans have started moving on in so many other activities, including opening our offices, opening our businesses. I think it would have been wrong for us to have our children post their lives, while generally we were moving on as a people. And therefore, there was need for us to start giving an opportunity to our children to also move ahead and move forward. Yes, we agree that with Mheshimiwa Dr. Nyikal, predictions will be difficult, but it is good to plan. So I think we are just giving indications, not necessarily giving predictions that we shall be able to open, but we are giving indications that given the trend and that this may be better, and taking some of the precautions as the President did the other day in bringing back some of the restrictions that were there, we would want to believe that with these restrictions, then, and with better management and with personal responsibility, that within the next 2 months, the situations will be better, and that we may be able to give an opportunity to our children to be able to progress with their lives. I acknowledge the concerns of Honorable Murgor, but you know, we are living in a dynamic world. We are now in an international, global village, and we would not want to isolate opportunities of our children into this particular country without looking at the dynamics that are happening in the global environment. What we just need to do is to see how we deal with situations, but I can say that our school environment is a safer environment for our children. It is a regulated environment. One thing that we are denying and that we are not telling ourselves is that when we leave our houses in the mornings to go to where we are going, either in business or in offices or wherever that we are going, is that we are not sure where our children go to immediately we leave our houses. They go out there to play in the field. They are in an environment that is not regulated, and they are exposed. So I think we need to look at it in a more wider perspective. We have to look at all these dynamics and be able to see which one of them is a better way in which we can move forward. But the most critical thing, I would say, is that our children are safe in school, and they are safer in a regulated environment, which that regulated environment is in our school environment. And that let's give an opportunity to our children. Let's not post their lives. Yet sometimes the problem is not the children, but the problem is ourselves as adults. So I would want to leave it at that. Yes, I think you can pick it from there.
Thank you very much.
Chair, there was a simple question Chair asked. How much would it cost to give children masks? Because if we say at 60 shillings, you should be able to give 2 washable clothes masks. Because I think this is something, this is like medicine. And this committee allocates money. And we may say, okay, if it is not too bad, we do it. So if we had that figure, it would be nice. I know you are a very hard-working minister. Me, I don't see him as being as bad as it sounds. It's his nature. He works hard. So, but if you have that figure, we may consider to support the ministry in that way.
When we are engaging ourselves within government, is that if we were to give 2 masks, we have 15 million children. We shall need almost 30 million masks. And on average, we shall require around 1 billion shillings in every 3 months. So I think we have to look at it in the totality. We are in a situation where there are declining revenues, there are competing needs, but that is what we would require. And I'll leave that to Wasiri.
Thank you very much. Let me also say that it is important, Dr. Nyikao, that we help those, Madam Chair, it is important for us to help those who cannot help themselves. That's a critical aspect. Not everybody. It is those who can help, who cannot help themselves. It is not supposed to be free for everybody. I disagree with that completely. Come away, we can't give you one. You have to buy one. So, Madam Chair, can I just summarize a little bit? And I want first to thank you for the comments. There are some, I have got some very good takeaways. Some extremely good takeaways I've got from here, including the idea of communication issues, a lot of communication issues that were raised here that I think are fantastic ideas, including where is oxygen, available, including how we are going to manage this whole thing about vaccines. Do we get the trucks to, completely, I don't know. This is a study we have to do. I don't know what the degrees of a refrigerated truck are. So these are things that we need now to go, and perhaps working with Kemri, see how to get that whole structure done. That's a fantastic takeaway for me. So I've got some many takeaways I don't need to belabor or to start all over again, to discuss all over again. And then on the issue of air travel, they're raised by Molgo. Maybe indeed, Dr. Kuria is here. He is in charge of public health. And I think that that falls directly into his docket. And it is true, by the way, that I flew from Mombasa the other day, and there was no social distancing. I would agree with you completely. Obviously, clearly, you are a lot more sensitive about the coughing, because I didn't pay much attention to it. Maybe it's because, anyway, but yes, you are right. You are right, Dr. Molgo, there is an issue. There is an issue there. Now, on two matters I want to comment on. Number one has to do with whether we drop the ball. There is this thing. Madam Chair, there is a way of ensuring that nobody gets the disease. There is a way. It can be done. Everybody stays at home. You stay at home, you don't move, you don't engage your neighbor, you will not get sick. And I think Dr. is here, will confirm that. Stay at home on your own, you will not get sick. There is a way. The question is whether indeed that is the way, whether indeed that is sustainable, or it can be done. And the simple answer is that it cannot be done. You will notice that this second wave, Honorable Kutuni, is not a Kenyan phenomenon. It is a global phenomenon. And as has been said severally in this forum, this is not a disease that we plan for, or we understand, or we can tell what is going to happen if you do X, Y, Z. We rely largely on modeling. And let me say this. The experts that you are referring to, who are helping us before, are working harder today than then. And in fact, they are advising us even more. Now we know them even personally, because we deal with them all the time. I can tell you this is from KU, this one is from such and such a place. Even the one you say, the one advising, you just asked about the one advising the Ministry of Education. Lois is a foremost, is a leading one, even in Kenyatta National Hospital. So the ones we are leading, and I've got a lot more experience now through this whole thing. So there is nothing like dropping the ball. And as a matter of fact, we are still doing a lot better than a lot of other people in a lot of other countries that we know. That is not to say that we are not losing people, because one person lost is one person too many. And that's a fact. But the truth also is this, that there was never an issue where you are not going to lose anybody. No country in the world has escaped this. People are dying. All right? People are dying. And we are trying to save as many people as possible. Indeed, at the start of this pandemic, The issue was to make sure that nobody gets the virus. That was the first move. Quarantine everybody, make sure. And there were two reasons for that. The first one is to ensure that the curve of infections does not go up so steeply the way it did in Italy that you are completely overwhelmed, that people are dying in homes and you don't know what to do. That is the first prevention, to ensure that you act in such a manner that you are still in control even as it comes. Because there was never a question of whether or not it will come. Coming, it will come. And it did come. So there was never that debate. Can we stop it completely? No. But can we act in such a manner that the curve with which the infections come is calm enough for us to be able to contain it and hold it in our hospitals? And I think so far we have. Now tomorrow, another story could come altogether. But so far, we have done exactly that. Now, the containment measures that were done, a lot of the containment measures have never been de-escalated. We have never de-escalated. The containment measures regarding weddings, public transport, churches and funerals and so on, those measures are still there. And by the way, those leading those measures actually know that they are still there. All right? Politicians know that the measures about gathering at 200, they are there, and we know them. All right? So the question is, what can these doctors do if a person has gathered people in Mukuru Wajenga of 10,000 people? What can the health officer do? So the responsibility, of to contain and to sustain what we are talking about, the restrictions, they all depend, let me tell you, my dear leaders, senators, governors, and members of parliament, and our people in the ministries. By the end of the day, we have to provide the leadership to change behavior. And if you ask me what is the most important thing, even as we discuss matters BBI, let us at the same time consider matters behavior as crucially as we are considering matters of BBI, and lead from that perspective. Because that is what is going to save us. It is matters behavior that are going to save us, not matters or other things. And that is a fact, and we have to agree with it and run with it. Because by the end of the day, there is only so much locking people you can do. The other issue about the restriction measures that Honorable Kutuni referred to earlier. You see, the restriction measures also, the results of restriction measures, you do not want to create a bigger problem than the problem you are trying to solve. You could take measures that create a bigger problem than the problem you began with in the first place. And yes, you will lose some people, it is a fact, and it is very unfortunate and very, very, very sad that we are doing so. But I think you do so, you lose some people when you have got a contained situation and you can take them to a hospital, rather than when you have got riots and everybody in the streets and even hospitals are not functioning. And these are situations that are palatable. These are unpalatable. And these are situations that you have got to address very realistically and very, very much on the ground. And there is nothing you can do to shift that responsibility. So is there going to be a time when we will know for a fact that this is the exact and totally fantastic decision to take? And my simple answer is no. That is not something I'm personally willing to promise Kenyans. But what I can promise Kenyans is that these are decisions that will be very carefully thought about, very carefully weighed, discussed by the highest brains that we have in the country, in epidemiology, in behavior, and so on and so forth. And all we can do at that point is ask Kenyans to come with us. Are we going to suffer? Yes. Let's go suffering together. Can we help each other? Yes, we can minimize the suffering. But all we can promise is we will do our best to try and contain the situation. And all the ideas that come from that end, we are going to take. There are a lot of them. We will carry them with us. I can promise you we will execute them. And if you have more, please do not hesitate to make us, to come with us. But let us at least carry Kenyans with us. As we go along, let's go with Kenyans so that they know, truthfully, let's be honest and truthful with them, that this is a global pandemic. There is going to be suffering. We have to sacrifice behavior. We have to sacrifice even money sometimes. And the only way we are going to overcome it if we work together in behavioral change. I thank you very much, Madam Chair. I look forward to the next meeting. I hope that we can all be in Malindi when 27th comes so that we can discuss all the other matters that are pending. Thank you very much indeed.
Thank you, CS, and thank you, the team from the ministry. Thank you, PS, and for your patience. I think it has been long. From 10 you came and went back, and you've been here. So, pass our regards to education.
Can I just say something, Madam Chair, if you don't mind? Just allow me 1 second. And that is to say that, different people handle things differently. And what I would like to say is that my colleague, the CS for Education, is an extremely well-meaning, he is an extremely hard-working individual. I know he is a friend of the Honorable
Point of order, Madam
I know he's a friend of Honorable Kutuni.
Why don't you allow him to?
I just wanted to say that I'm not defending anybody, but we have different ways of working, different ways of handling things. And asanteni sana.
Yeah, maybe you might need, every time there's orientation, there's some training on PR, eh? Your colleague may need some training on how to handle other people.
Received the term 2. Again, the 30% has not been remitted. I think it is important. And then the salaries were deducted from the initial share that had been sent to the school, so it affected the budget of the schools. And then COVID cash.
Honorable,
I think it is important.
Kutuni.
Thank you.
We'll allow you to escort the PS, and I know you can also, the teachers know you are representing them well.
But
Thank you,
Chair,
Honorable Members, but yeah.
I think it would be good, Chair, to mention that we have paid monies that were due to schools.
You have paid everything?
Yes, that's important.
Okay. It's good information. So as I let the CS and the PS leave and the team, Honorable Members, we might take just 5 minutes health break because we have Honorable Jaldesa and I've seen Adoni wa Mushomba. We'll only have 2, and for Adoni it's very easy. For Jaldesa it's also going to be easy. So we'll take less than 1 hour to be here, and then we can leave early. Thank you. Kuna maziwa, CS?